Speaking of vaccines, let's talk about Robert F. Kennedy Jr. You heard a moment ago what he's been telling, what he told a while ago, Vaughn Hilliard of NBC, that he's never been, quote, anti-vax. Experts still concerned if Kennedy is confirmed by the Senate to be the nation's top health official, he will exacerbate the already concerning rise of vaccine hesitancy in the United States. Joining us now, former Treasury official, Morning Joe economic analyst Steve Rattner. Steve, Bobby Kennedy sort of hides behind being a skeptic of vaccines. Therefore, he feels he can say he's not anti-vax. But let's walk through some of the data behind all this. Your first chart is about what vaccines actually do, which we need to remind people of these days.
Yeah, and you guys covered a bit of this. Joe actually could have come over to the Southeast Wall for his comments because he would have had some charts to help him along. But let's just talk about polio first, being perhaps the most famous case. Polio really erupted in 1916 in Brooklyn with a lot of cases, but then it took off again when FDR, remember FDR got polio in 1921, and that spurred the first effort to really develop a vaccine. Some of us may remember the March of Dimes, where everybody gave a dime to develop a polio vaccine. Coincidentally, you had a huge spike in polio in the 1940s. In 1955, the polio vaccine was licensed. I want to inject a personal note here. I was one of the first cohorts of people to get injected, and I remember well how excited and relieved my parents were that their kids were not going to have to worry about polio. And polio, lo and behold, dropped to 0 cases today. And the red line here are the deaths, of which there were a significant number. You guys mentioned COVID and Operation Warp Speed, an amazing accomplishment, a vaccine developed in less than a year. And we have really good data comparing people who got the vaccine to people who didn't get the vaccine. And you can see the weekly death rate. This is the Omicron surge, which we all remember all too well, unfortunately. This is the death rate for people who did not get the vaccine. This is the death rate way down here for the people who did get the vaccine. And for people who got the booster, an even lower death rate.
So your next chart, Steve, as we move across the wall, is some of the other benefits that come from vaccines to our society. What are you looking at there?
Yeah, so again, we went down a similar path with a lot of other childhood diseases. Again, I grew up in a world where all these diseases, not smallpox, but most of these diseases were ones that we were susceptible to as kids. But look what's happened. From an average of about 530,000 cases a year of measles back in the 20th century, we've dropped down to 47, 99% drop. Whooping cough, similarly, mumps, 99%. Rubella, which is also called German measles, 99%. We've essentially eradicated smallpox everywhere in the world, which is an amazing accomplishment. Polio, 0. And then that has had a significant impact on childhood mortality rates around the world. Essentially, this is the death rate of infants under the age of 1. It's dropped from 10% back in 1974 to about 2.8%, I believe that is, in 2024. And this is what scientists estimate the death rate would be without vaccines. 101 million, call it 100 million, infants around the world have been saved over this period of time because of vaccine rollouts around the world.
All right, so let's move over to your final chart, Steve. Some other concerns if Bobby Kennedy does get this job at HHS. He has talked repeatedly about taking fluoride out of the water, another of the great accomplishments of the last century. What are you looking at there?
Yeah, this is also in the anti-science ignorance, whatever category you want to put it in. But fluoride in drinking water has been an enormous, made enormous improvements in tooth health. So you can see here the percent of people who are drinking fluoridated water. This was a study done between 1967 and 1992 by the Centers for Disease Control. The percentage of people drinking fluoridated water rose from 40% to just about 50%. The average number of decayed teeth dropped like that from about 4 to about 1.4, if I remember correctly. Yeah, 1.4. And it's not all fluoride, of course, better care of teeth and so on and so forth, but every health expert would tell you fluoridated water played a significant role in that. Let me, though, turn to an issue in which Bobby Kennedy actually is on the right side of, frankly, in my opinion, which is the whole, or at least partially, because he's got some other ideas around this that are less sensible, perhaps. But on the issue of food and what kids eat and obesity and so forth, we have had an upsurge in type 2 diabetes among children. It used to be considered an adult onset disease. It is happening more and more among children. It is closely linked to obesity, and that, of course, we know what the nutritional issues are for kids. Not surprisingly, kids of color have had a much higher rate of childhood diabetes and a much faster growth in it. We have a huge nutrition and weight problem in our country among kids. And this is actually an issue in which I think there's some agreement. I'm not sure taking food dyes out of kids' cereals is really part of this, but certainly the cereals and McDonald's and all the rest of that is contributing heavily to this.
Well, I mean, Steve, we'll see what happens there. I remember when Michelle Obama and Michael Bloomberg talked about obesity and the like. They were hammered by conservatives saying, don't tell us what to eat. Don't tell. The thing about obesity, though, especially childhood obesity, but obesity in general, it is such a massive issue. It is such a massive healthcare issue. It is also a massive fiscal issue. The costs of Medicare and Medicaid would plummet if we seriously addressed obesity. So I'm with you. If there is a renewed focus on childhood obesity from whoever is the next HHS director, that's obviously an important thing. And also, I don't know, this is radical. Getting like kids in school out, running, exercising. Like, you know, everybody's so competitive and, oh, am I going to get into this school or that school? Yeah, that's great. Do that. But you got a better chance to study, exercise. You know, if you're out there exercising, if schools make their students move more. And I always remember, speaking of a Kennedy, I always remember JFK's Presidential Fitness Award or whatever when we were growing up that encouraged kids to get out there and exercise. And now this is where you respond, Steve, and you go, yeah, Joe.
Steve, over to you.
It's the first time he's done this, so, you know, he's going to be good second or third time. I'm joking, Steve.
Yeah, of course, Joe, you're absolutely right. And I also do remember the Kennedy challenge, I think it was called, to get us all out to exercise. And the obesity problem is much more than a child problem, and it's much more than a type diabetes problem. It is, as you say, it's adding massively to our health costs, massively to our Medicare costs. And it's something that we need to do something about. But again, as you also said quite correctly, the Trump administration rejects anything that they can categorize as being the nanny state. They just simply don't believe government should get in the way. And by the way, when you talk about things like fluoride in the water, there's enormous pushback, particularly out west, on fluoride in the water. And they're actually taking fluoride out of the water in certain places. And so this sort of anti-healthcare, anti-science mentality that exists in certain parts of our country, among certain parts of our citizenry, I think is really scary and dangerous.
Yeah.
This vaccine stuff, how can you possibly say, you know, that vaccines are a bad idea? You know, we invented the smallpox vaccine. The first one was 1796. It wiped out smallpox over time with a lot of help from Bill Gates and others. But think about it. Would you like to have smallpox back?
No. Steve Rattner, thank you so much. My bad assist to you on that last question. Thank you. These